Death ends a life, not a relationship. At least that's what I told myself when sitting next to Louise as she was in a hospital bed in her living room. I learned firsthand ALS as my boyfriend's grandmother, Louise, who was like a grandmother to me, was diagnosed with ALS. I had to help, along with her nurses, take care of her and watch as her condition slowly deteriorated. ALS is a fatal disease that slowly hinders a person's ability to move their body, but does not slow down the mind. Imagine losing your ability to walk, or even move your arms. How would you go where you needed? Who would be there to help you? That is something that people with ALS are tasked with each and every day. Today I will discuss how it is diagnosed, what treatments are available, and what research is being done to hopefully cure it. Amyotrophic lateral sclerosis is a progressive neurodegenerative disease that affects nerve cells in the brain and in the spinal cord. Myo refers to muscle and trophic refers to nourishment, which means that there's no nourishment to the muscles. Motor neurons are degenerated and eventually the brain is unable to initiate and control muscle movement. Although majority of ALS cases are sporadic, there are some that are familial, about 10%. Luckily for my boyfriend's family, Louise's case was not familial, it was sporadic. ALS is a terrible disease that can affect all people differently, which is part of the reason why physicians have a rough time diagnosing the disease. For many individuals, the first onset of ALS, or signal of ALS, may appear in the hand or arm, and they may have difficulty turning a key or writing. In other cases, symptoms start in the legs, so they may feel pain or they may feel awkwardness when they walk. This is called limb onset ALS. In other individuals, they first notice it in their speech with stumbling over words or stuttering, even swallowing problems. This is called bulbar onset ALS. For Louise, her first signs were in her foot. She had a pain when she would walk or do any physical activity. She played tennis a lot, so she went to a sports medicine doctor just to see what was wrong. She eventually developed drop foot, and this lasted for a few months before they sent her to a neurologist to do some tests. Unfortunately, she was diagnosed with ALS. ALS is primarily diagnosed based on the detailed history of symptoms and signs observed by a physician during daily checkups. However, the presence of upper and lower motor neurons strongly suggests the presence of the disease. After physicians have diagnosed someone with ALS, there are only treatments that can improve people's lives. There is no cure. So there's medical intervention, which would include medicines, medications like Rilotech, which is believed to reduce damage to motor neurons. There's also physical therapy, which can include walking, swimming, riding on a stationary bike, which can help improve cardiovascular health and keep people from being depressed or feeling fatigued. Louise did physical therapy during her early onset of symptoms, but once she was wheelchair-ridden, she was unable to do the things she loved. Next, there's nutritional support, which people get weaker as they lose weight because they're not eating as much, it's harder to swallow. So a nutritionist can come and advise patients on a healthy diet that can help nourish individuals, and eventually a feeding tube may be necessary as the disease progresses. Since there is no cure, various organizations are working hard to find a cure through countless research processes. Scientists have developed ways to take skin or blood cells from an individual with ALS and even turn them into some stem cells, which are capable of becoming any cell type in the body, which this could include motor neurons and other cell types that may be involved in the disease. Using both animal models and cell culture systems, scientists are trying to determine how and why ALS-causing gene mutations lead to the destruction of neurons. One of the most significant breakthroughs in the last decade has been the discovery of the number of genes that are flawed when they cause ALS. Biomarkers are biological measures that help to identify the presence of the rate of a progression of disease, So since ALS is difficult to diagnose, biomarkers could potentially help clinicians diagnose ALS sooner, earlier, faster, whatever could help. So we have now learned what ALS is, how it is diagnosed, and the treatments available, and the research that is being done. While ALS is hard to diagnose and does not have a cure, there's a lot of research being done and treatments that exist to increase the quality of life of the people who've been diagnosed with the disease. Referring to the quote that I shared at the beginning of the speech, a life that is lost to ALS does not take away the meaningful relationships that the person had during their life. ALS can attack the present body, but it cannot take away the memories and experiences that the person once had. Rest in peace, Louise. Thank you.